A 76-year-old presented to us with blurred vision and a mass in the upper lid of the right eye of 10 months duration. He gave history of B-cell leukemia for which he was on chemotherapy. Past medical history was significant for history of nephrectomy, but 16 years ago, but he did not have any details why he underwent nephrectomy. On examination, his visual acuity was 636 and N10 in the right eye, 6.9 and N6 in the left eye. Ocular examination showed right eye non-axial proptosis with a firm, tender, non-tender, multilobulated mass over the supratemporal part of the right orbit. The fundus examination showed choroidal folds. Left eye was normal. CT imaging showed a mass in the upper outer quadrant of the orbit, indenting the globe, and bone also showed a scalloping of the bone. And with this short duration of 10 months and with the erosion of the bone and with the compression of the globe, we made a diagnosis of it could be a lacrimal gland tumor, possibly a malignant tumor. So as you can see in the previous slide, it was almost extending up to the orbital apex. It realized that it's not possible to remove it by the ophthalmologist alone. So we sent the patient for neurosurgery opinion, and they said, let us do a biopsy. So incisional biopsy was done. To our surprise, histopathology showed a very different lesion. It showed a cellular tumor with closely packed nests and acini and trabeculae of large tumor cells with clear to some eosinophilic cytoplasm with a round nucleus and small nucleoli. Branching network of sinusoidal vascular channels with the foci of hyalination and pigment-laden macrophages were seen. IHC was positive for CD10 and PAX8 was also positive. So this is a histopathology slide showing PA stain showing the clear cells in the right side, and CD10 was positive. So all this gave to PAX8 was also positive. So this gave us the diagnosis of, it was a case of metastatic clear cell renal carcinoma. There was no other evidence of metastasis. Patient was investigated. There was no other evidence of metastasis anywhere else in the body. Usually of all the renal cell carcinomas, clear cell is the most malignant one, but most common metastasis is to the lymph nodes and to the liver and the bones. But there have been cases where orbital involvement have been reported without any systemic involvement. And the duration between the primary and the metastasis can vary from 6 to 18 years, and the longest was 25 years. So this was the one review which was published in IJO. There they said the longest case that presented with orbital metastasis was after 25 years. That's about it.